Neurological, this is where I get into neurological exercise to improve brain function. So the kids that I work with will do eye exercises, coordination targeting exercises, switching them inside of the classroom. I'll get into sometimes breathing exercises, get into balance, get into all sorts of different things. I have some patients that do musical instruments that will have them work on timing exercises. So it depends on the child and what's going on with them, but it's sometimes there's a lot we can do just to stimulate that brain, whether it's from the left side or the right side, whether it's doing finger painting with their left hand or dribbling with the left hand or other things. So it's sometimes where you can work with the child, work with parents, or even as adults that I work with, where I'll give them different exercises or activities to improve how that brain is working. Did a study 2005 that showed 95% had improved behavior with sensory intervention therapies. An improvement was seen in restlessness, impulsivity, and hyperactivity in children receiving the therapy. Okay. Brain areas increase when joint receptor signals are more frequent, and the areas actually decrease when joint receptor signals are less frequent. Areas in the brain. Okay.
So that's exercise.
Activity. So that's exercise and movement. Yeah. You get into 30 minutes of aerobic exercise a day is typically what I get into, or what I recommend for kids. Did a study showing the map in the human brain changes with each motor activity one performs. So as you do things, different areas in the brain are worked. So you get into development. And that's where if you stimulate the brain, so even children who don't necessarily have any significant symptoms, if we can improve how the brain is working, it just improves performance. And as those pathways are developed, you can lose more of those pathways and still maintain function. Okay, so it's something that's where a child, if you keep them active and exercising, it'll help them later on in life because they can actually lose more pathways and still maintain function. Now, experiences shape the sensory brain. Deprivation shrinks it. They did a study with mice, and they showed that mice that were licked more as babies had actually decreased stress and decreased cortisol levels compared to mice that weren't. Okay, showing that any kind of stimulation when you're younger improves function. Yes?
And I think that bears witness to how so many children lose their knowledge over the summer vacation because they're not getting the stimulation that maybe they'd be getting during the school year.
One good thing is they typically get more movement. Usually, there's a book out there called Where Have All the Children Gone? And it actually talks about how you go through neighborhoods and you don't see kids running around. So one thing, we have a couple of retired couples that live next door to us, and that's something that they mentioned. They see our kids more than any other kid out there. They're running around in the yard. And, we have a rule that even when it is Friday, Saturday, or Sunday, that they can only do screen time for 30 minutes without an hour of some kind of physical activity or movement. Okay, now we give exceptions for movies and other things like that, but if they want to play video games, we have a little timer. They turn it on, and then it goes ding, walk outside. So it's one of my oldest boy's friends that were doing video games, and it had been 30 minutes. And I said, okay. Everybody out, my kids run out, he still's playing. I'm very consistent. My dad's a retired colonel from the Air Force, so okay, time to get outside. And he goes, hold on. So I walk over to him, I said, I'll show you hold on. I pick him up, carry him outside, put him outside. You know what? He went outside the next time. But movement is so important. And that's where you get into chiropractic. That's where you get into movement and adjustments, and that's where people chiropractic that deals with back pain, neck pain, ADD, ADHD, movement. That's what we do is improve movement and mobility in the neck and the body and the spine. There is many muscle spindles, which are receptors for movement in the neck, as in the rest of the body combined. And so that's where it's huge if you have a child that has a misalignment in their spine. We adjust that, and that starts moving. There's tons of studies on movement, improving how the brain works. Chiropractic adjustments, improving mobility of the joints. Okay. Reduced curve of the neck with possible link to ADHD. They actually showed a correction of spinal misalignment is correlated with a significant reduction of symptoms. Okay, 2004. Studies suggest chiropractic manipulation has the potential to become an important non-drug intervention for children with ADHD. This was back in '89. Okay, so I'm going back. It has actually went from 77. Positive relationship was found in school children with skeletal motion restrictions and learning disabilities. Okay, so this has been around for a long time. The problem is there's not as much money in it as there is in some of the pharmacological treatments. Okay, so it's something that movement drives that brain, and that's what we do. That's where I think all children should be checked They don't always have to be adjusted. Kids are some of the few patients where I get in here, and he's great, she's great, a couple little spots, maybe adjust one thing, send them on their way, kind of like taking to the dentist. You know, I want people, take your child to the chiropractor. Well, absolutely. You know, take your child to the dentist. He doesn't have a toothache. That's why we want to prevent that. So it's something that oftentimes preventative, well, always preventative is far better of a focus. Okay. Okay, so we kind of talked a little bit about causes of ADHD, some different treatment options of ADHD. Now people need to kind of realize some of the scope of the problem. Okay, ADHD is actually, is actually the #1 childhood psychiatric disorder. Okay. The U.S. consumes 5 times more Ritalin than the rest of the world combined. Okay, so put that down there. Ritalin, you can almost put any stimulant medication in there. Okay, so I kind of put, most of this will be from Ritalin just because it's been out the longest. Okay. Oh, Ritalin use has increased 700% in the past 10 years. Okay. United Nations Narcotics Board has twice warned the U.S. about its dependence on Ritalin. Okay. Indiana is actually the 4th worst in the country for kids on these medications. Okay, whereas Colorado tends to be pretty low. You know, is it a difference in the children, or is it really just prescription trends? Okay. 9 to 10 times more common in boys. Over 90% are boys. Okay, that tends to be because the female brain develops faster, but we're seeing far more girls with that as well. Okay, so it's just something that people will say boys and girls just aren't the same. They develop differently. They have different developments. And so you see the boy, and the boy tends to be a little more active or stand out a little bit more. Okay. 3%, 6% of school-aged children, okay, on estimate, and actually up to 20% in some U.S. cities. And that's the problem, is because they're actually, some parents are fighting for the diagnosis because you get extra time when you take some of the SAT tests if you get diagnosed with that. Schools actually get extra funding for kids that have been diagnosed with learning disabilities. So you kind of, it's great for them to have some extra intervention, but you get to where it's just people looking for labels. Okay, goals of treatment. Chemical, they're attempting to balance the chemistry of the body through artificial means, relying on medications to control the symptoms. Chemical treatments are non-specific on where they work. Goal with what we're doing with nutrition and changing an environment and working with the child is trying to allow the body to balance chemistry by improving function, trying to treat the cause more than just treating symptoms. Okay. Benefits and risks of treatment. So for every treatment you choose, there's going to be a positive and a negative. Okay, both with all treatments, whether it's chemical and even with what I do, there's some issues that we'll kind of go through. But chemical, all drugs have side effects. Okay, whether they're seen or not seen. Drug dependence. The DEA has classified Ritalin as a Schedule II controlled substance. It's in the same category as cocaine and methamphetamines, and can lead to severe psychic dependence. Okay. Rapid onset. Reduced hyperactivity and impulsivity. They've actually shown 70% of kids improve on stimulant medication. Okay, but the benefit may not hold beyond 2 years, so then they start adding in other medications. But, okay, so just because a child has a positive response doesn't mean they have ADD. You know, anybody who takes speed in college gets a little bump in their focus. You stay it all night, and then you focus a little bit better. It doesn't, it can bump up anybody's focus temporarily. Mode of action isn't completely understood. Stimulants can temporarily sharpen almost anyone's focus. The physician's desk reference, it's actually from that, quotes, Ritalin should not be used in children under 6 years of age. And I have a lot of kids younger than that taking it. It's actually one of the fastest growing age groups is 2 to 3 year olds. I know. I have never met a 2-year-old that wasn't, ADHD bouncing around. And that's great. You want to kind of encourage some of those things. You still want to kind of help them to focus and develop control. Adverse reactions that they have listed: stunted growth. They actually have a study showing over 3 years, typically they lose an inch in height, and actually just under 5 pounds. The drug companies will say that they catch up later on, but there wasn't any studies on that, so it's kind of a over 3 years an inch. That can happen pretty quick with some of the kids, with how many years they're taking these for. Okay. Nervousness, insomnia, loss of appetite, tachycardia, increased heart rates, okay, headaches, blood pressure changes, hypersensitivities, Tourette's, kind of movement disorders that can be affected. They actually have studies and reports of kids who have died from taking Ritalin and stimulant medication because people know like methamphetamine, how it affects the heart. And these are basically stimulants. And so that's where, limited use and controlled use. So stimulant use is highly discouraged from a neurological, biochemical, medical perspective, yet highly encouraged from a symptomatic, that's looking at symptoms and how the patient responds. They improve. We need to get away from just symptoms. Just because you have a symptom, if somebody eats some food that's bad, has something growing in it, you get sick and throw up, that was a positive symptom. That got rid of something, got out of your body as fast as you can. Now, healthy would have been to avoid that in the first place, but you take something to stop that and you keep that bad thing in you for longer. So symptoms aren't always the best thing to look at. Okay. Cellular, they require special informed consent. And liver enzymes are supposed to be tested every 2 weeks when kids are taking that. So here's kind of interesting one. If a child takes Ritalin after the age of 12, he may not be eligible for military service. Okay, put on there may not because they don't know. They actually ask, have you taken Ritalin or stimulant medication? Okay, after the age of 12 on some of the entrance forms. And so you kind of go, I've talked to different people that said different things, that they don't ask about ADD, but it's the medication. Okay.
Because it would cause some sort of unpredictable behavior.
If you look at psychotic episodes,
Oh,
when we go back to that list on there, okay, so many times these kids, go on it because they have little focus issues, and suddenly they start kicking other kids, start getting more violent, start having, instead of just focus issues, they just explode. Okay, what's kind of scary to look at is of the school shootings that I've looked into, 100% the kids have been medicated. Okay, from Columbine to the guy in Virginia for college. They all are taking medications. It's one of those, there's actually lawsuits for the one in Columbine and some of the other ones against the medication.
You mean ADHD
Yep.
medications?
Some are ADHD, some of them are some antidepressants, okay, but 100% we're taking psychotropic drugs to treat some kind of condition. You said, well, you'd think that it'd be more likely to occur on the people that were unmedicated if the medications were really improving the situation. Okay, so kind of interesting things to look at. Okay, and also Ritalin is one of the fastest growing high school, college drugs of choice. They crush it, snort it, or inject it to get a high, to get that rush, that buzz. Okay. Neurological chiropractic, we want to treat the cause rather than just the symptoms. Improve the body's control of brain chemistry. Movement and experiences drive our brain.